Hello, everybody. Good evening. My name is Cynthia Alverez, and this is the Grand Boulevard Coalition show. Unfortunately, no guests today, but we hope to plan to have some guests in the future. So please look forward to those. Um, but the topic for today that I will be discussing will be about Mental Health Awareness Month. Since May is Mental Health Awareness Month, I thought it would be good to talk about mental health care in our communities, talk a little bit about some statistics, kind of get a little bit more into macro level type mental health. And macro level is just another way of saying just kind of a bigger picture of what mental health looks like in our communities versus individuals. Kind of like we've talked about in other shows. We've talked about anxiety, depression, suicidal tendencies, what that looks like, and other cases like that. So this is kind of more of a broader picture of mental health. So yeah, but before we get into that, we do have some upcoming webinars with Chicago Area Project. I don't have any flyers for today, but just check out the Facebook page for Chicago Area Project. That's all you have to search on your Facebook. You can find flyers and information on there. We have some youth webinars coming up, so if you're interested in things like that and you have know any youth, please feel free to look up some very interesting webinars through Chicago Area Project on Facebook. But yeah, so if you joined us last time, we had an interview with one of our interns, Mesa. She was a great intern to have, and it was great to get her insight on everything that we talked about, just her interest in social work. And yeah, so she just graduated actually this month, a few weeks after that show was recorded. So we will be posting any newsletters, information on how proud we are about our interns and all the great work that they've done for us and how appreciative we are of them. So any newsletters and things like that will also be on our Healthy Living social medias, Healthy Living. And yeah, so feel free to check us out on Facebook as well. So getting a little bit more into the topic of mental health awareness, it's important to talk about just because we need to raise more awareness about people who might still not feel comfortable sharing, talking about their feelings and, kind of leading into diagnosis for whatever mental health issues they might be facing. So this month kind of focuses on that just to kind of destigmatize the topic, allow people, youth and adults, even older adults as well, to feel more comfortable sharing their feelings, just the things that they're going through, their traumas, highlighting people's stories, and just kind of emphasizing that this month and just, yeah, trying to focus on the stigma that is still around for mental health issues. But like I said, we're going to focus more about communities and how mental health care how it looks like in our communities, right? So, yeah, we're going to get into some statistics. So, according to the National Institute of Mental Health, in a survey from 2022, it's estimated that more than 1 in 5 U.S. adults live with a mental health illness. So, that's 59.3 million in 2022. So, yeah, that's basically 23.1% of the U.S. population, which is something interesting to think about. And kind of thinking a little bit more about young adults versus adults and older adults. Young adults ages 18 to 25 had the highest prevalence of any mental illness, and that was 36.2%. And that's compared to adults aged 26 to 49 years old. That was 29.4%. And ages 50 and older, so that was 13.9%. So kind of comparing all those percentages, that 36.2% was mental health issues that we're seeing more in young adults, right? So that's something that's interesting to think about, right? Especially with a lot of things that youth are going through nowadays. Things are different now than they were before, and just a lot of the different struggles that youth and teens go through, especially with, online, social media, trends, harmful trends, and things like that, can kind of impact young adults' mental health a little bit more than older adults. So those are just a couple things to think about. Obviously, it's not just social media, but a whole bunch of other factors. And according to the American Psychiatric Association, even though rates of depression have lowered in Black and African Americans and Hispanics more than whites, depression in Blacks and Hispanics is likely to become more persistent. So that's according to the data that they've been looking at. They kind of noticed those trends and noticed that the trends of Black and Hispanic Americans that have been reporting more feelings of depression, going, to get diagnosed and getting diagnosed with depression, chronic depression, things like that is kind of the trends that they're noticing, which is interesting to think about. And also, people who identify being two or more races are more likely to report any mental health illness within the past year than any other race or ethnic group, followed by American Indian, Alaska Natives, and then white and Black populations. So why is this interesting, right? Thinking more about people who identify as being two or more races, people who are biracial, multiracial, just have a very blended family. So, people who are half and half of other races, it can kind of make those people feel a little bit more isolated, right? Because that is a smaller percentage of people who identify as multiple races. So they kind of feel a little isolated. They feel like there's nobody who can really relate to them and the things that they face, even in their own families, right? Their families might be a little divided. They might feel like they don't belong to one side of the family or the other side, just because their experiences are so unique compared to maybe those of their older relatives who can't really relate or help with them with kind of the experiences that they're going through, right? So that can kind of put them into a bit of a bad mental health space, facing more isolation, depression, feelings of anxiety, and just feeling like they can't speak out about this with anyone because no one will really understand what they're going through, right? Unless they find the right people, either at school, in their communities, who can relate to living as someone who is multiracial, right? So it's kind of something that is difficult for people to be able to work with them on. So just kind of finding people that can relate to you and your experiences, right? Because that's how you find support systems. People are, our support systems are people that can relate to us, people who share similar experiences to us, right? So if we can't have that or can't find that, it becomes a little bit more difficult to process your own feelings. And yeah, so that I thought was really interesting and wanted to bring that up as well. And then also they mentioned American Indian and Alaska Natives is also like a very small portion of the population too, right here in the United States. So also that feeling of isolation, lack of resources, which we're going to get into. We're going to talk a little bit more about why there are these disparities, and these barriers, what the different barriers are, right? So yeah, just thinking about Alaska Natives, and American Indians, just that their experiences are so unique, especially if you look generationally, which we kind of talked about more specifically Native Americans, I believe, in a different episode. We talked about Native Americans and the struggles specifically that they face and how it impacts their mental health, addictions, and things like that. So yeah, that's really important for us to think about. Also, people from racial ethnic minority groups are less likely to receive mental health care. So, for example, in 2015, among adults with any mental illness, 48% of whites received mental health services compared with 31 Black, African American, and Hispanics, and 22% of Asians. So those two, percentages were lower compared to the white population in terms of who is receiving mental health, right? Mental health services. So, even though there are maybe more Black and Brown communities and minority groups facing more mental health struggles and challenges, they are not seeking the mental health help that they need to kind of overcome or work through the mental health challenges that they're going through, right? And so, why is that? It's important to think about that and how that affects the communities, right? And thinking about communities as a whole. So, um, uh, yeah, so kind of thinking about some of those barriers. One of those barriers could be financial barriers. And financially, people just can't afford these extra services, that they might see those as non-necessities. So it's like, people have to put priorities, especially if they're not making enough, income to support. If they're barely making enough to support themselves or their families, they're not going to see their mental health as a priority or as a need. Financially, they cannot afford it. They cannot make the time for it, especially if they're working a lot just to, put food on the table. They might not see that as a priority, so they will never reach out, especially if they don't have insurance and their insurance doesn't, or if their insurance doesn't cover mental health supports. Um, and some insurances don't offer that, so unfortunately, they're not able to afford it, even if they might have not mental health, medical, medical insurance, right? So that's something to think about. And mental health illness, obviously the stigma that's around it, especially, if you think about culturally, different cultures that still, don't feel it is acceptable to talk about addictions, traumas, who kind of, or minimize people's traumas, right? Like, oh, that didn't happen to you, or oh, if you try to have conversations with your parents or older relatives, they kind of shut it down, those conversations of, oh, that never happened to you, or oh, you're just exaggerating. So it kind of makes, younger adults a little bit more afraid to open up and want to talk about their traumas or things that they went through, their feelings, or if a child has a disorder, a mental health disorder or a mental illness, they might just say, "Oh no, they're just they're lazy, or they don't do they don't really talk a lot." So they kind of chalk it up to simple things like that instead of kind of getting into the deeper issues of what could be going on with their child. So kind of minimizing those feelings, those symptoms that they might be seeing in their kid, or dismissing that in general, right? So it could be hard to talk about within your own family, which kind of brings up that stigma. And, people who get bullied for maybe talking about their mental health issues, people who might be more open to it, might get picked on or things like that, especially, talking more about youth, younger people, people in high school, maybe even in college too, right? Especially with online bullying as well. That can also have an impact on mental health. And yeah, so that kind of contributes to that culturally, within kids, younger kids who don't fully understand the importance of mental health, because it hasn't been explained to them, or they just don't know, right? So that stigma, also lack of cultural competent mental health providers. That's a big one too that I feel like is really important to think about, right? Because let's say you finally decide, hey, I want to find a therapist. I want to find somebody to talk to. I think I need a diagnosis. I think I might have depression. And you want to speak to somebody, a psychiatrist, a therapist, and you meet up with these, make an appointment, you meet with them, and they might be a little dismissive, especially if they are not of your same, ethnic background. They might minimize your feelings that you're explaining to them. They might say, oh, no, that's nothing. You're okay. You don't feel this way. So that can kind of lead to either not getting a diagnosis at all, and you still, go on with your life and not getting the help that you need because these professionals don't have the cultural competency training to understand different backgrounds. And it's not to say either, right, that a therapist who is of one skin color cannot be helpful to a client of another skin color. It's all about that cultural competency training that professionals need to take in order to have a deeper understanding of people who do not come of their same background, right? So just kind of learning about different cultures, being exposed to different cultures, um, and taking trainings, webinars that kind of further explain, the different disparities that other minority groups go through that we might have never gone through, right? But it helps us gain an understanding of how we can further help people who might need the mental health help. So if they don't have that training, then they're not really, there's going to be a disconnect with therapist or psychiatrist and the client, which can end up badly for the client, more specifically, because, like I said, they won't end up getting the actual help that they might have needed in that time, especially when they're putting themselves out there and reaching out. It can kind of make them scared to reach out again, right? If they have one bad experience, they're like, okay, I'm not going to do this again because I wasn't heard the first time, right? So that can have a serious impact long term, on a person who wants to find that mental health service that they need. Yeah, so then also thinking, culturally with language barriers, that's also another thing. Language barriers, especially if you don't speak English, but you want the mental health help, there might be a lack of providers that speak your native language, because that's going to be the best way for you to navigate through your feelings and process your feelings, is to find somebody who can actually speak your language, because they can better understand you, versus if you try to speak in English and that's not your native language, it might be harder for you to get your emotions across, and you might not like the experience, especially if they don't understand where you're coming from. So that can create that disconnect as well, and just kind of make people afraid to try to reach out, because they might feel like, oh, it's not worth it because I'm not going to find a therapist that can speak my language, or it's just going to be a little bit more difficult. You're going to have to go through a little bit more hurdles to try to find somebody that can understand you language wise. That's a big thing too. And then also healthcare deserts. That's another thing. It's kind of similar to food deserts. So if you know what a food desert is, it's basically, long, let's say you live in a community and you want to find a grocery store as close to you as possible, right? The most convenient grocery store, but that's not for a few miles. So you're going to have to think about transportation, how you're going to get there. Some people need to take CTA or public transportation. And you have to think about, oh, I got to take this bus and then a train. And that's kind of the same with healthcare deserts, right? If there's not enough healthcare resources in your community, then you're not going to feel like it's going to be easy to find those mental health services, especially if there's nothing near you, especially if there's nothing good near you, because you also want to, make sure that you're going to a place that, has clients that have had good experiences, right? Because obviously there's no perfect place to go to, but, you want to go somewhere that you think has a good chance of giving you the best services, right? So if you don't find that in your community, in your neighborhood, you find out, oh, the best place that you want to go to is 10 miles away, and you have to figure out how you're going to get there. That's going to create that extra barrier. And in terms of transportation, like I mentioned too, you're going to have to figure out how you're going to go, and does it even feel like it's worth it anymore, right? So that might not be a priority to you anymore, especially if you don't have any places nearby that you're like, oh yeah, I can go to this mental health place that's 10 minutes away from me. That's not always the case for everybody, right? Especially if you're thinking about lower south side, west side communities, there's not a lot available, or not a lot of the services that you might specifically need, that also if you think about substance abuse treatment programs, if you're looking for rehabilitation centers, a lot of the good places, or places where, you'll get the best services, they're going to be on the north side or in the suburbs. You're going to have to travel really far for those places. So it's not going to be really convenient for some people to travel to those places. So that's another barrier. And also distrust in the healthcare system. That's a barrier too, because you might have had, like I said, bad experiences. That might kind of push you away from wanting to look for more help. You might not want to look for more help because, oh, I had a really bad experience with this therapist, they talked down to me and made me feel less than, and I don't really want to do this anymore. Or even if you haven't experienced it, but maybe you had a family member who experienced something negative in the healthcare space. They said, oh, I didn't like that. It was a horror story, right, for them. And so they tell it to you, and you're like, oh, well, I don't want to do this anymore because, my mom or my uncle, they had a really bad experience, and that's kind of scaring you away from wanting to reach out as well, right? These things can happen, especially there was something, looking into specifically African Americans have, according to the American Psychiatric Association, mentioned that African Americans have been misdiagnosed at higher rates than white patients, and Black communities have been exploited by the U.S. government and medical communities in the name of medical advancement. So there have been specific cases. If you look into U.S. history specifically, how they have been injected secretly through measles, and these patients didn't know that they were given injections for measles. They were lied to. And so, other cases like that happen to these communities makes them distrust them, especially, if you have had generational trauma experiences that can all impact their experiences and them not wanting to go. So those are all the things that can happen. And it's really important just to kind of think about those, right? You have to think about why some people might be hesitant to, especially if you're in the mental health space as a provider, as a professional, people who might be cautious coming to you, who might be afraid coming to you, you need to be more understanding, more patient as well, and just making sure you answer all their questions. You're as patient as possible, just trying to give them the best service that you can. And yeah, let them know like, hey, I'm here with you. We're going to go through this together. We're going to go at your pace. And if you need to take a break, I'll be here. But, I encourage you to keep coming back because your mental health is important. Saying things like that, making sure you reaffirm your clients, your patients, as best as you can to make sure that they do return and get the help that they need, right? So yeah, some of the things that can be done to support these communities. Encourage people to volunteer or work with community organizations that can help connect you to like-minded people that can understand your experiences growing up, in the community you live in, can help you, just connect with others and make you feel like you're less alone, that other people understand your experiences because they've also gone through the same thing. Kind of helps you feel more connected to your community and yeah, can kind of help with mental health, right? Because you're building a support system for yourself. Also advocate for your community and share affordable resources. So obviously not just mental health, but if you find, spaces for youth that they have for free or, like YMCAs, places where kids can play sports, can just have like youth talk discussions, which is things that we do at our organization, having virtual, easily accessible workshops for kids that are free where they can talk about mental health or things going on in their communities as well. Yeah, community events too, going to those, just being around people in your community, kind of building that connection, right? And then creating safe spaces. If you can't offer safe spaces to your whole community, obviously that's okay. But you can start small by creating safe spaces for friends or family, people, that you know and love. You can invite them over, if you have the space to do that, having just time, making time maybe once a month to just have family over and connect through things that can, like movie nights or game nights, things that can help you be more connected to your support systems that you already have, right? So yeah. Also advocating for policy changes, which is a big one because with the current administration, we are going through some budget cuts that impact mental health resources and many other resources. So making sure you're putting your voice out there, talking to your representatives, making sure that you let them know mental health resources are important to you and your community, can, help put that pressure on them to make sure they vote in favor of you and your communities. So, yeah, those are a few things that can help. Obviously, if you want to learn more, there's a lot of information out there, community Facebook groups, things like that. That you can look into as well. So I hope this helped. I hope you learned a little bit more about mental health in your communities and awareness. And I hope you share this information with anybody. I want to thank you all for taking the time to watch today, and I hope you all have a good rest of your evening. Thank you. Good night.